Hey, everybody. We're going to come together. Our mayor is here, and we're so grateful to him for joining us in this wonderful opening. I'm Dr. Mitch Katz. I'm the proud CEO and president of New York City Health and Hospitals. I'm also a practicing internist on the Lower East Side, and so many of my patients have suffered from the complications of COVID, complications that occurred following long hospitalizations in some cases, other people who had relatively minor illnesses from the acute episode of COVID, but had long standing respiratory problems, neurologic problems, cardiac problems, and are still suffering. And they're feeling like, oh, people are talking about this illness as being minor, this Omicron is going away, but I'm still suffering. And this center is here to say we see you, and we're going to take care of you. We're going to make sure that your needs are met, and we're going to take care of you with empathy and compassion. With that, it's now my pleasure to introduce the mayor, and I just want to say people think of him correctly as an expert in public safety, and we desperately need that. We need the guns off the street. He's released an amazing plan to make sure that we're all safe. But I want to acknowledge he's also the health mayor. And I'll give you just one example of how far-reaching it is. Yesterday, I had a meeting with him, and he was on the exercise bicycle during the meeting. And I was thinking, this is amazing. This is just what we need, is a mayor who emphasizes the best parts. Health is more than taking a pill when you're sick. Health is all about prevention and getting enough exercise and stress reduction and eating right, and our mayor is amazing at doing all those things and serving as a model for us. So, Mr. Mayor, please.
Thank you. Thank you. Thank you, Dr. Katz. And I'm just really happy to be here with my good friend, the new borough president of Brooklyn, Antonio Reynoso. Our real health professional on the city council, my girl Mercedes. Always good to see you, councilwomen. And I believe Senator Salazar and Assemblywoman Davila may be, I thought you was walking the other way, is also here. So we're really represented. And I cannot say enough about Dr. Katz, Dr. Long. Each morning we're on the phone together talking about this issue. And all the healthcare heroes, just amazing team. Look at this space. It's a beautiful space. And you feel comfortable coming in here, treated with the dignity and respect that you deserve. Every day they are rewriting a narrative about this health journey that we're on, and I want to thank them. And today we're actually adding a new chapter to this narrative. And it was only, 2 years ago that we were hit with COVID virus, and there was a feeling of uncertainty, and that we were not going to get through it. And the healthcare professionals, if it's in Jacoby Hospital, if it's in downstate, if it's in Wyckoff, Woodhall, no matter what, they stepped up to the challenge, and we cannot thank them enough. And I want everyone to think back to those days and how difficult it was. But we were once identified as the epicenter of this virus. And not only the entire city, but specific neighborhoods and communities, Elmhurst, Bed-Stuy, parts of the Bronx, Staten Island locations. And when you broke it down, the numbers were clear that some parts of the city were hit harder than others, and it was block by block. This is one of the blocks. And when you think about during that time, these were the elected officials who were on the ground fighting on behalf of their people right around this area, the Sumner houses. They bore the brunt of COVID-19, dealing with more cases, losing more friends. Those numbers that we were revealing were not just numbers showing the number of deaths and loss. People were driving their family members to the hospitals, never to see them again. Unimaginable. The trauma, the trailers out front at hospitals holding bodies, it was hard. And it wasn't just that it was bad luck. It was a bad distribution of resources throughout our federal and state levels, and we need to get it right. And so I say that the decades of inequalities and inefficiencies of providing for these communities is something we need to have as we reflect on a recovery. And today we're talking about how do we bring our recovery task force together to deal with these important issues. And health equity is at the heart of what this campaign or this administration is about, and this campaign of improving health is about. I know Antonio opened a center here around healthcare. He uses capital dollars to do so, and he's looking to do it throughout the entire borough of Brooklyn. And so for 2 years now, we've seen the virus expose our inequalities. And we're not going to accept it, and we're going to make sure that this administration we will close the gaps. And this center right here in this location is a powerful symbol that things are changing. A good, clean, healthy space with professionals who are going to ensure that people get the respect and dignity that they deserve. And it's not only about beating COVID, as Dr. Katz stated. People think you get the virus and it's over. No, there are some health care issues that are long-standing after you get, bless you, Gloria, after you get the virus. It continues to have to be dealt with. And so what we want to do right here in Brooklyn is strengthen our long-term approach to health care with a holistic approach. We're going to serve the whole community and the whole body. Not only COVID patients, but everyone. Pediatric care, adolescents care, women's health, and a floor dedicated to diabetes. That is the feeder of so many other issues. Highest level of amputees, highest level of blindness, highest level of other issues that feed out of diabetes, and this facilities is focusing on diabetes. We can drop those numbers. You can drop so many other numbers that are associated with it, and so we are really encouraged by that. And we're going to treat the whole person, as I stated, whether that means state-of-the-art COVID care, having a primary doctor for the first time. The emergency room is not a primary doctor. You know, it's about a primary doctor that is using all methods to stay in communication with their patients, and mental health. The numbers are expanding and younger when children are dealing with mental health and family members are dealing with mental health, and we want to really deal with those issues. The bottom line is every New Yorker must get what they need to feel healthy, both emotionally and physically. And so, you know, I got to take my hat off to the Department of Design and Construction. You guys did your thing. You did your thing. Building 3 centers in less than 6 months. Unbelievable. Something that normally would take 6 years. And Tom and his entire team, Christine, you did incredible work. And this is a beautiful, beautiful space where you feel healthy by what you come in. It shows what we can do. That is why part of my overall belief in making government more efficient is to get the bureaucracy out of getting stuff done. And Tom, you and your team showed that we could do it in a real way. And so let me conclude in my comments by stating vaccination boosters. So that is our most potent weapon against a virus that is really a formidable opponent. It shifts, it changes, it comes out with new variants. It is crucial that people are vaccinated and boosted. And so we want to encourage New Yorkers to do so. And this is how we have fought back COVID, and this is how we're going to continue to make sure that we are successful in doing so. So again, thank this entire team, thank the staff that's here. You did an amazing job for this community. This is how we get it done. Teamwork makes the dream work. Thank you so much.
Thank you, Mr. Mayor. We're so grateful for your being here and for your support. I next have the privilege of inviting up Dr. Ted Long, who not only is the head of ambulatory care for health and hospitals, but also has been the leader for the Test and Trace Corps. People learned if you want a test for COVID and you want the result tomorrow, you're going to come to the public sector. As I bring Ted up, I'll just tell you one funny story. Those of you who know him know that he is a man of boundless enthusiasm. So once I sent him an email asking him to do something, and he said, sure, I'll do it. And there are only 2 exclamation points after that. And so I email him back, what's the matter? You don't want to do it? Why don't you just tell me if you don't want to do it? Why are you just sending me only 2 exclamation points? I know if there are only 2 exclamation points, you don't really want to do it. Just come clean. What is the issue? With that, Dr. Ted Long.
It was my way of saying no. So I am very excited to be here today. This site really is our future. The last 2 years with COVID have been really hard. We've been focused every single day on fighting COVID. But today, we get to take an important step forward and change our focus to look at our recovery, what our future can look like through this new Center of Excellence. Now, I'm a primary care doctor. I've continued to see my patients in the Bronx throughout the COVID pandemic. And the hardest thing for me throughout COVID, when I go to clinic every Friday, is I'm seeing my patients suffer. A month after they got COVID, I'm seeing my patients that still have shortness of breath, neurologic complications, cardiac issues, depression, fatigue, even hair loss. They're frightened and they need help. Unfortunately, up to 1/3 of people that have had COVID will go on to develop these lingering symptoms, or as we call it, long COVID. Good news is, though, help is on the way. This new site here will have all of the services tailored in an evidence-based way to treat everything we know about long COVID. We'll have a cardiologist to help you with your heart, a pulmonologist if you're having difficulty breathing, a neurologist, mental health professionals if you're battling depression after having had COVID. And importantly, we're going to provide all of that tailored care in the context of comprehensive primary care. So you should bring your whole family, and everybody will get their checkup, we'll get cancer screenings, we'll use our on-site radiology suite, which even has an MRI machine, see the eye doctor, see the foot doctor, see the dentist. Everything you need to be healthy and recover New York City style under one roof during that one visit, you can get here right here at this new Center of Excellence. Now, again, I know the last 2 years have been tough, and especially in this community of Bushwick, you've been through a lot under COVID, and you deserve this new site. And I'll be quick. I just want to make one more important announcement. So this coming week, we can't let our guard down yet. The fight isn't over, but we're here to help. This coming week, starting on Monday, we're announcing that we're going to be distributing hundreds of thousands of at-home tests at cultural institutions and libraries across New York City, so that there can be no wrong door to getting tested to know your status so you can know what to do. We're going to be going live on Monday, and importantly, getting tested is how you stop COVID. So please, come to one of our sites we're going to be announcing, get a free test, and help us fight back. Thank you.
Well, great. I've spent my career in the public sector, and so it always gives me great pride when the public sector performs. And I want you, as I bring up our DDC commissioner, look around this building, right? What better testimony can we have of what a great job the public sector can do when given the leeway to make it happen. So, Commissioner, please.
Thank you. Thank you very much. What a fantastic day. We are so delighted to be here today. I will make this quick because we have to do some amazing work throughout the city. But make no mistake, this was when we initially did the walkthrough here, there was leaks coming in from the ceiling, from the roof. There was structural deterioration throughout the building. There was abatement and 10,000 other things. And within 6 months, our team was able to work with our partners at H&H and complete a beautiful, beautiful healthcare facility for the community, which was desperately needed, and we're absolutely delighted. This is a 55,000 square foot area space, medical space, and it was approximately $65 million. Again, it was all done in 6 months, which would normally have taken several years, 5 to 6 years. During the pandemic, because we had the authorization to do so as engineers and architects, we built out field hospitals, testing clinics, vaccination sites, and obviously 3 COVID centers of excellence for the city at $120 million. And I really wanted to thank our team for their amazing work. Lorena was out here. She was the boots on the ground 7 days a week. She's from Brooklyn, so she was out here. The only time I got nervous about Lorena here is when she got hit on her moped, but she survived and she was here, so she's all set. And I really wanted to thank the mayor for his support and making sure that, for his support and partnership going forward to shred through the bureaucracy to allow us as engineers and architects to build amazing things in record time throughout the city. So we're super excited and really appreciate the invitation today.
Thank you.
At our end, working with DDC is Christine Flaherty and her team, and they did an amazing job, and I'm very grateful to all of you. I also want a shout out to Michelle Lewis and her team as the CEO for Gotham, which is the parent organization running phenomenal clinics throughout New York City. People know that there's nothing I believe in more than the relationship between a doctor or nurse or other healthcare provider and a patient. I'm very focused on, that's what we're here for. We're here to make those relationships work. And so I want to introduce Dr. O, who is our pediatrician here, who'll be working with the families that we take care of. Dr. O?
Hi, everybody. Good morning and welcome. My name is Dr. Odugua, and I'm a pediatrician here at Gotham Health, Broadway. Today's event is an important moment to celebrate the opening of a wonderful new community health center of excellence in Brooklyn. Gotham Health sites are located throughout New York City and dedicated to the communities they serve. We recognize that providing welcoming environments, understanding community needs, working with elected officials and community-based organizations to meet community needs is essential to our ability to keep New Yorkers healthy. This is a comprehensive healthcare center that provides one-stop shopping. People can have all their healthcare needs met in their community, including primary care and pediatrics, specialty medicine, behavioral health, dental and oral health, and state-of-the-art digital imaging. Discounted fees are available to uninsured patients through NYC Care to ensure that New Yorkers will be able to access services regardless of their insurance status or ability to pay. This health center not only serves the Bushwick community, but also all of Brooklyn by being a COVID-19 center of excellence. Hopefully someday the COVID pandemic will be behind us, yet thousands of New Yorkers might face years of health challenges resulting from COVID-19 illnesses. This COVID Center of Excellence, as well as 2 sister facilities open in the Bronx and Queens, demonstrates our resolve to support the victims of this terrible pandemic with the highest level of specialized care. Again, New York City Health and Hospitals and Gotham Health is stepping forward to ensure that the long-term healthcare needs of those who are infected are addressed. In conclusion, we'd like to thank the Mayor's Office for their advocacy and support to ensure that all New Yorkers have access to health care. Today, we see a wonderful example of the fruits of those efforts with this ribbon cutting. I'd also like to thank the Health and Hospitals senior leadership, Gotham Health CEO Michelle Lewis, Gotham Health leadership, elected officials, community partners, and the Gotham Health Board, along with the staff who I'm very blessed to work with. And of course, I'd like to thank you all for joining us today. Thank you.
So glad to have you here. Now, maybe it's just because I'm a Brooklyn boy that I naturally think that the Brooklyn Borough President draws the very best people, current or past. So with that, one of our great Health and Hospital champions has always been Borough President Reynoso, who uses our services for his family and promotes them to everyone.
All right, thank you, Doctor. Thank you, Doctor. Thank you so much. So, welcome to the center of the universe, that is Brooklyn. I just want a quick fact, though. Bushwick is actually the center of the city of New York, physically. Bushwick is the center of the city of New York. So I'm not talking here figuratively. It's objectively the center of the universe. I want to shout out Camacho, the board chair that is here from Community Board 4. Gregory Calise, the CEO of Woodhull Hospital, who's been doing this work practically by themselves in these communities, to have an auxiliary space like this to be able to help in the work that you're doing, I think is going to be great. Dr. Katz, you want to talk about emotional intelligence and people that care and that actually want to get this done. This is the guy. This is the guy, Mr. Mayor. I just want to say Dr. Katz has been nothing but great. When you let good people that actually know what they're doing do what they do, this is the type of things we see. I also want to shout out DDC. You know, they got a lot of slack for things. I think we should talk about long-term, Mr. Mayor, we should talk about procurement, because this got done in 6 months, faster, cheaper, more beautiful, and we're going to save lives because of the fact that we had this emergency movement. And I think we should talk about procurement so we don't wait 6 years to save the lives of people like here in Bushwick. I grew up about blocks away from here in Williamsburg, and I just want to say this building specifically was an eyesore in this community. It was tagged up outside, a lot of graffiti. They weren't taking care of what I think is like a historically beautiful and significant building. Inside, it looked even worse. It was used for many different things that never really panned out. And now it has been restored, and it is this glory, this beauty that we're going to be able to allow for constituents from Bushwick and all of Brooklyn to be able to use. I hope that Bushwick can be the same way, that even if it's tatted, even if it has its graffiti, even if the people inside and out healthfully need help, and that we can restore them the way we restored this site, because that is what I think is going to be the biggest difference. We talked to CEO Caliste of Woodhull. We have tons of people with coughs walking into an emergency room instead of getting primary care work like in facilities like this. But it's not their fault. If you look, it's a handful of primary care doctors in all of Bushwick, if even, because places like this people don't go there because they don't think the money's there. The health problems are here, but because there's no money, they don't want to be here. And that's when government steps in. It says we'll do that job because we don't care about the money, we care about your health. So I'm grateful that we're here celebrating this. And to the mayor, I just want to say, you know, it's been a long 2 months, or a month and a half. And I just want to highlight that, like, I'm here as a true partner to this mayor. I want to really let you know that there are a lot of things happening in this city, and we need all hands on deck. We don't got time to be nitpicking over things that are not malintentioned, right? But are things that we care about. I'm here today because this is important, right? And I'll be at the next one that he calls me to. I'll be at the next one that he calls me to, because we need a lot of help, a lot of help. And we need to come together as New Yorkers and really change what we're talking about so that post-pandemic looks a lot different than pre-pandemic. And that's only going to happen with partnerships. It's more difficult to build than it is to destroy. But I'm focused on building, and I'm really looking forward to the next 4 years in this partnership that I'm going to have with this mayor, if this is the type of work we're going to continue to see. Thank you so much. Oh, wait, in Spanish, very quickly. In Spanish, very quickly, just in case. Estamos aquí celebrando en Bushwick este nuevo centro de salud, detrás del trabajo que hizo el alcalde Adams hoy, y en 6 meses vimos la construcción de un lugar a donde su salud se puede cuidar primariamente. En vez de ir a un centro de emergencia, pueden ir a este lugar aquí en Bushwick y su salud se puede cuidar. Le quiero dar las gracias a todos los que hicieron este trabajo, y sabemos que nuestra salud es algo que se tiene que cuidar. Hemos sufrido tanto por COVID, y ahora con este centro podemos atacar eso, comenzar a luchar contra lo negativo de nuestra salud. Y por eso le quiero dar las gracias otra vez al alcalde Adams por ese trabajo. Muchas gracias.
Qué suerte que él es el presidente de Brooklyn. Sí, qué suerte. I want to point out, I have my great CEO, Greg Calise, who last we saw him, we were borough president. Remember, we were at the Woodhull new emergency department opening, which never would have happened without you. So now I want to bring up Assembly Member Davila and thank her for being here and for celebrating this with us.
Thank you. Wow, what a wonderful day, right? probably about a year and a half ago, maybe 2 years ago, everyone was just confused, hurt, people losing their families, not knowing where to go. And I want to shout out Mr. Calise, because our hospitals were the staple that were handling everything. They did not sleep. Families, mothers, fathers, sisters, brothers, cousins were lost without having the opportunity to say goodbye. Let's think about that. Yes, we're celebrating something that is remarkable. More important than that, it's in Brooklyn. But I want to thank everyone. I want to thank the mayor for taking the ball and just running with it. I want to thank all of you for really thinking about the overall process on how this pandemic has affected people emotionally, physically. Our children, we're still getting sick, right? So we don't know where we're headed. But this is the place where they can come to get answers, the very same answers that we did not have 2 years ago. 2 years ago. It sounds like a long time ago, but it was just yesterday. So once again, I want to thank you all for putting this whole entire beautiful project that's going to help our communities, especially Black and brown communities, because let's face it, all right? We saw these trailers in the middle of our blocks, in the back of Woodhull Hospital, in the corners of Wyckoff Heights Hospital, taking up blocks, trailers, freezers. I will never forget that vision. I will never forget that. But I will never forget this. Because this is what we need to start doing. Promoting good health, letting people know that they're not wrong. If they're suffering from an illness after COVID-19, there is a place to come. They mention your neurological services. They mention mental health. They mention children's center. They mention a whole slew of services just surrounding COVID-19. So I am thankful once again. This is my district, and I have to tell you, I will support you 1,000%. Anything you need from me as your assemblywoman, I am here. So thank you so much. God bless all of you. Pa'lante, vamos a seguir. Este es el centro donde tienen que venir. Si ustedes piensan que han sufrido cualquier cosa de COVID-19, aquí es que pueden traer sus familias. ¿Ok? Aquí en Bushwick. So, muchas gracias por su atención. Que Dios me los bendiga a todos. God bless all of us because we need that. Thank you.
No, please. That's our nurse.
Hi. Good morning. My name is Mercedes Narcisse. Yes, I am the chair of Hospitals Committee, and it's a pleasure to be here. As a nurse for over 30 years, I learned to appreciate things like this that we never seen in our community, especially high-risk community. So, Mayor, I don't know what to say. You know I've been a supporter of yours, and I will continue because health is paramount right now. We have to address our health, and especially in the community at risk. And as a matter of fact, I want one like this in Canarsie. I want many. In Canarsie, in the 46th district, I have no hospital, no community health center. So we're waiting for the next one. And as a chair, I'm going to go around everywhere at risk, especially around NYCHA houses, close proximity. We need those like this to bring something else, uplift people that we need to uplift in our community. So God bless you. I'm not going to take time. Thank you so much, Mayor. Thank you, my Borough President, my Health.
So we're also joined a representative from Congresswoman Velasquez's office as well. So what we want to do, why don't we do on topic, cut the ribbon, and then we'll let everyone else bounce, and then we'll do a few off topics. Okay? Let's do on topic.
Mr. Mayor, and for the doctors as well, what can you tell us in terms of what data and information the city has gathered so far about people who are experiencing long COVID? obviously, there's been a lot of discussion about it, about some of the symptoms that people experience. But what does the data show you so far?
People have tried to figure out, can it be predicted who's going to get long COVID? And the answer is no. So there's a defined group of people whose long COVID is because they were on a respirator for 3 months or had a very prolonged hospitalization. Those people need rehabilitation. But what has been much harder for physicians and scientists to understand is that there are people who had even very minor episodes of COVID, or maybe didn't even know that they had been once infected, and though they continue to have long-standing effects. It's thought that those effects are probably primarily immunologic in nature. They're not due to the active virus, they're due to the body's response to the virus. So what happens is the virus is in your body forms antibodies and other defenses against the virus. Then sometimes those defenses get over-souped up and they begin to attack other parts of the body. And so that's the leading theory on what it is. What we do know is that people do get over it. So we believe that that people who have long COVID, they're not going to necessarily have it for their whole lives. And our goal is to try to prevent damage. Mayor asked me yesterday to convene a group of New York City scientists to learn more and to discuss more. So it's an area of very active interest right now.
And Doctor, if you could also just speak about what long COVID may feel like to, I know it's different for different people, but for people who are hearing about the center and who are maybe thinking, oh, that's some of what I've been feeling, I should go in there.
Yeah. I'd actually love to start with that question because it's very personal for me. I'll be seeing in my clinic this afternoon probably a patient or two that I care about that has long COVID. So I would characterize it as people that are still suffering from any symptom, a month after having their infection, and most of them I think are suffering in silence. I think they don't understand, they're frightened, they don't know if this is related to COVID, whether they should just wait more time, whether they should see a doctor, and many people don't have doctors. So for me, for my patients that see me, I can take care of them. But what keeps me up at night is all of the people that are suffering in silence that don't have me or Dr. Katz, who's a better doctor than I am, that can take care of them. So the first part of your question, if I can go back to that, in New York City we have something special that I don't know if anybody else has this, and that is that we have something called our aftercare program. Through contact tracing, which is where we called everybody that had a positive test result, we've consistently reached 90% of all cases across New York City. We can do that again. We can see how people are doing now. We can see who's still having symptoms, and we can connect them to care. We've already started that. We've sent hundreds of thousands of text messages and phone calls to see how people in New York City are doing. So that if you've had COVID before, you've probably talked to us before. 90% of the people before COVID before Omicron had, and we're going to be reaching out proactively over the next, several months, 6 months, a year, to make sure we're checking in with everybody. And if there's anybody out there suffering, it will no longer be in silence because we're going to talk to you directly, and we're going to give you an opportunity to come to this site. Thank you.
Hello, Jason Berry with NTD. I'm not sure who the question would be directed to, but it was mentioned that if people want to come to the hospital and they don't have insurance or money, I'm just kind of curious how that process would work, who would pay, and also if there's any promotional effort to let people know that they can come if they can't pay out insurance.
Health and Hospital is very proud that we provide care to everyone regardless of the ability to pay. And that was codified in the last administration in the creation of NYC Care, where we not only will provide all levels of care, including pharmacy, laboratory tests, radiology, hospital, but we'll guarantee people who join a primary care visit within 2 weeks at one of our centers. So we have a lot of local media, and we're glad for today's announcement as another chance to reiterate that people do not need to suffer in silence, that we have a whole network of clinics and hospitals that are ready to take care of people regardless of immigration status, regardless of the ability to pay. Thank you.
Let's go to Ribbon, and then we come back.
Michelle Lewis. Michelle Lewis. Spread these out.
Okay, yes, wait now. Yes. So we want to, so let's clear up so I could do off top, a few off top. Okay, brother.
All right.
Appreciate
I'll
you,
be catching
man.
up. Yeah, anything you need?
Yes. Yep. So a few off topics. Yes, no, without a doubt. Our approach to healthcare is going to be a holistic approach. We're going to look at how we feed New Yorkers. We're going to look at how we treat people with symptoms, how we prevent chronic diseases, how do we connect all of our agencies to creating a more healthy, holistic environment. And all of this is connected. We did several announcements, and they're all part of the overall plan that we are rolling out.
Quick follow-up. So even though it's called the COVID-19 Center, if you don't have COVID or you didn't have COVID, you can still come, right?
That's right. It's called the COVID Connect Center. But if you have COVID or you don't have COVID, still come here. We want people to start viewing healthcare as primary care, not emergency room care. Thank you.
Mr. Mayor, what is the total number of municipal personnel who are facing termination at the end of today?
No, I got you. This morning, we had a call to do the analysis. We're going to come out with the full numbers over the weekend. What we do know that we have had an amazing response from city workers, and we are truly encouraged by those numbers, but we're going to give the exact numbers. Because part of the problem was some people had their vaccines, took both their shots, yet they did not turn in their information. And so now we will be able to give you an accurate account, but the rough estimates, it is truly impressive that New Yorkers are responding and stepping up.
Going to be fired or forced to quit, however you want to describe it.
The call is there. It's not about termination. It's about vaccination. We want people to be vaccinated. I don't want to see the city close down again. And all we can do is continue to encourage people, get vaccinated, and hopefully people get the booster shot as well.
And to follow up on Matt's question, do you have any sense yet, is it less than 4,000 municipal workers at this point that are going to get fired? And secondly, the people who do end up quitting or being fired, will you replace them?
We're going to do it. Remember, we're right-sizing government. Remember, I stated that from the beginning. That's why we're doing the 3% PEG. We're going to right-size government. Those areas that we need to replace, we are going to replace. We're going to do a real assessment to make sure taxpayers are getting their money's worth. And so those who determine that they don't want to go with the obligation that is required, there was a temporary restraining order that was filed. The courts rule on our behalf, and so this is the law of the land. People must follow it, and hopefully people will just listen to what we're saying, hear my voice, and just get vaccinated, protect their families.
What's your message to...
No.
Come on.
Easy. Because we will stop if you're disrespectful to my staff. If you got a question and I can get to it, I'm going to answer it. But she has a job to do like you have a job to do. I'm going to do the best I can. But when it's time to bounce, I'm bouncing.
Have a follow-up?
Yes, you can. Yes, you can.
I was wondering what your message is today in Brooklyn Federal Court. Some municipal workers at risk of getting fired filed a lawsuit, still saying that they're not going to get vaccinated, accusing your administration of religious harassment. What's your response to them?
The rule was put in place under the previous administration. Here's my fear. My fear is if I come in and change that rule, I'm saying to all of the New Yorkers who understood we were at a very dangerous place and they complied. So if we get another variant that's dangerous and we say to New Yorkers, this is what you must do to help us keep the city open and save lives, people are not going to take us seriously. That can't happen. If we make a comment, we have to live up to that comment. And so those who are using the criminal justice system, I respect them to do so. But right now, the law of the land, you have to get vaccinated. Get your question, and then we have to move on.
So yesterday, the Willoughby Avenue open street got taken out, was put back in. The DOT said that it was a result of a miscommunication. People have told Streets Blog that that miscommunication started in the mayor's office at City Hall. Can you explain what the miscommunication was that led to that open street getting ripped out and put back?
Here's what I could explain to you. I'm the mayor of the city. People did not elect a staff member. They did not elect someone else. They elected me. And when the information came to my attention, which I was not aware of, when it came to my attention, I called the commissioner. I stated, is this something my councilwoman wants? And once I was told no, I was very clear. Put that street back. I believe we need safe streets. Particularly, we're looking at too many crashes where young people, even children, are being impacted. This is something I believe in, and I'm going to live up to. So if someone in my office carries out an action that did not come from me of that magnitude, I'm going to make the decision instantly on how to reverse that. If I felt that street should have been opened, I would have made a public announcement to do so. And so how the miscommunication happened doesn't matter to me. The street is now back a closed street, and that is what I made sure took place instantly. I did not analyze and look forward. I'm an instant get stuff done mayor. Thank you.